So we're going to get started. I'm going to share my screen. This is going to be informal, casual, and comfortable. I am going to share my screen because I have some information. I think that for me, it's just easier to consume information if I also have a visual. So I want you to have a visual as I kind of talk through. Because I'm going to be sharing my screen, I am not going to be able to see any chats or any of the comments. But what I will try to do is periodically stop and take a look at the chat and see if anything comes up. But otherwise, we'll have a Q&A session towards the end. I said that this was 8:30 to 9:30, but I don't think that it's going to take that long. And I do want to allow time for comments. So we should probably have about 30 minutes of this conversation and then about 15 minutes or so as long as needed for conversation. So I'm going to go share my screen. And let's see. And we're going to get started. All right. So, oh, wonderful. I can see the chat. If you can just let me know, you should be able to see the screen. But if you can see the screen, can you just put a Y in the chat? Okay, good. I see two people raise their hand. Perfect. All right. So we're going to get started. This is 5 things that you need to know about cervical cancer prevention. This is such a great topic. January is Cervical Health Awareness Month. So it's a great time to be talking about cervical cancer prevention. And then also, I don't know about you, but many people love to get their pap smear and their screenings done at the beginning of the year, just because that's a way for them to kind of stay on schedule with their pap smear screening. And it's an even better time to have a conversation about what you need to do. We are going to go on a journey together. We're going to do an introduction. We'll do some background about cervical cancer screening. We'll talk a little bit about the anatomy of the cervix. Then we'll get to the 5 things that you need to know about cervical cancer prevention. We will, as always with Lady Parts Doctor, talk about advocacy and how you can advocate for yourself as far as cervical cancer screening is concerned. And then also this advocacy, the questions that we're going to discuss will be something that you will be able to apply to other health concerns that you may have. And then finally, we'll close and we'll answer some questions that you may have on cervical cancer screening and cervical cancer prevention. This is a webinar that I'm putting on through a grant by the Black Physician Healthcare Network. Through Lady Parts Doctor. I'm Dr. Stephanie Hack. I am a board certified OBGYN, affectionately known as the Lady Parts Doctor. And I love health education. I love health literacy. As an OBGYN, seeing patients in my office, I found that I love educating. And it's very important to me that my patients understand what is going on with their health care and that they feel knowledgeable enough to make healthy decisions in their lives. Like my job was never to tell them what to do. As physicians, our job is to give recommendations for you to feel knowledgeable, for us to care for you, and for you to be able to make decisions about what you want and need. Well, I found that I was having the same conversations and kind of going through the same basic information with my patients, things that many times as OBGYNs we felt were common knowledge, but they weren't common knowledge. And in the office, we didn't always have the amount of time to be able to really educate and share the information in addition to providing the care for what our patients needed. So I said, you know what? I want to do this. I'm going to start a podcast. And so I started a podcast, which is the Lady Parts Doctor podcast. And then I said, you know what? Let's just kind of keep providing information. And so we're going to do that through webinars. We're doing that through courses. There are guides. I recently created a guide on what to expect at a visit to the OBGYN. So I do all of that through Lady Parts Doctor. It's ladypartsdoctor.com. And that QR code will take you right to the website. But I wanted it to be a health platform that sees you and hears you, because another thing that I often hear is, women and my patients didn't feel seen or heard in many circumstances. And so it's important that you feel seen and heard. Now, I also have to give a disclaimer. All of this webinar and the information that's provided is strictly for informational purposes. This is not medical advice. This is not medical care. This is not a patient-provider relationship. I have to say that because it's not. This is education and information. And I hope that you have, and I am happy to provide additional resources if you have additional questions after that I'm unable to answer and kind of point you in the right direction. All right. So, why is cervical cancer prevention so important? We see everyone for their PAP, and I think it's so commonplace that maybe we forget why it's so important. And so, cancer prevention is important because each year in the United States, there are almost 12,000 new cases of cervical cancer that are diagnosed. And these cases are often in people who are not properly screened and not screened routinely as they should be, but there are still 12,000 new cases. And approximately 4,000 women die from cervical cancer each year. And what's crazy about that is up to 93% of these cases are preventable, and they are preventable through cervical cancer screening, and they are preventable through vaccination. So it is very important that you get your pap smear when you're supposed to. And we're going to talk a little bit about what that looks like because it's going to be different for everybody. But I just had to take a moment to stress really the importance of getting your cervical cancer screening and getting your cervical cancer screening on time. So, what does the cervix even look like? And I think it's always good when we talk about things to just kind of have. So if I am looking at you and you have a uterus and a cervix, or maybe you used to, if I'm looking at you and you're facing me in your pelvis, you would see your uterus here. You can see me pointing this out. And then this part where I have the arrow, this is your cervix. Okay. If I am doing a pap smear, and I'm actually going to show you a clip in a little bit, if I'm doing a pap smear, I'm going to put a speculum into the vagina. So this is the vagina here where I have the arrow, and then I'm going to look from the outside, and this is what I'm going to see. And this is what a cervix looks like. It's like a pink donut. It's round, not very big. It's actually probably about the size that you would see on the screen. I'm using my laptop, so it might be a little smaller if you're using your phone. And when we do a pap smear, we are specifically looking at certain tissue in what's called the transformation zone. And that is an area in the cervix where the cell type changes from one cell type to another. And that is where most HPV infection and cervical abnormalities, if you're going to have an abnormal pap smear, that's where we're going to find it. So we have a little broom that we use to just kind of tickle some cells off the cervix here. And that's where we're looking. So we'll see that a little better in one of the upcoming slides. Oh, and this is, since we're talking about anatomy, I always love to take a moment to do this. This wonderful picture here, many of you know, this is a vulva. And I have to say that because people often use vulva and vagina as the same thing, but they're not the same thing. So the area that you see outside, this whole structure here is the vulva, and then this little pink area and inside, this is the vagina. So to the 5 things that you need to know about cervical cancer prevention. First, and one of the most important things to know is that human papillomavirus, HPV, causes most cervical cancer. Over 90% of cervical cancers are caused by HPV. When we talk about HPV, there is what we consider high-risk HPV and low-risk HPV. When we screen for cervical cancer, we are testing for high-risk HPV. And the reason for that is high-risk HPV is what's going to cause the changes in your cervix that go on to develop into cervical cancer. Low-risk HPV is more likely to cause, if anything, genital warts. Low-risk HPV causes genital warts. You may not have any symptoms, but that's the thing. And genital warts are not going to they're not going to kill you, for lack of a better word. But we're concerned about what could actually be very harmful to you, and that would be high risk HPV. So, some other things to know about HPV: it is very, very common. In fact, the lifetime risk, so if you've been sexually active in your lifetime risk of getting HPV is about 75 to 80%. So most people who are sexually active are going to get HPV at some point in their lifetime. As we mentioned, the low risk HPV types, so I'm going to get a little specific, a little technical, but it's okay. You don't need to know this per se, but I'm just going to share a little extra information with you. So the low risk HPV types, 6 and 11, are going to cause most genital warts. They cause about 90% of genital warts. They're caused by HPV types 6 and 11. We also have HPV types 16 and 18, and they cause about 70% of cervical cancer. Now, we know of 13 high risk HPV types, and we know of at least 150 plus HPV types altogether, but about 13 of those we know are high risk. So 16 and 18 cause about 70%. And then there are other HPV types, 31, 33, 45, 52, and 58. You don't have to remember that, but they cause about another 20% of cervical cancers. And of note, which I didn't share, but HPV is caused by skin to skin contact, and that's how it's transmitted. It's also important to know because HPV is spread by skin to skin contact, it is not just going to cause cervical cancer. HPV causes other types of cancer as well. It causes penile cancer, it causes vaginal cancer, it causes vulvar cancer. Okay, so you could have cancer on the vulva, so on the labia and outside. And then you can also have cancer in the vagina that's caused by HPV. HPV also causes anal cancer. And it also causes oropharyngeal cancer. So it can cause cancer of the mouth and cancer of the throat. And again, that is spread by skin to skin contact. So, one thing that I started to ask all of my patients in the office, because I found that a lot of times, women were just going to get their pap smears, but we weren't really explaining why pap smears were important. Pap smears are cervical cancer screening. So when you hear, oh, I'm going to get a pap smear, you are specifically screening for cervical cancer. It is completely different from an annual exam. An annual exam is the visit, and you might have a pelvic exam. So every let me phrase this properly. Every pelvic exam does not include a pap smear. Some pelvic exams, we do no testing. And the pelvic exam includes the portion of your exam where we insert a speculum into the vagina. Let me see. Now I have a speculum in my desk because I'm an OBGYN, I keep these in my desk. But we insert a speculum into the vagina to look at the cervix, to look in the vagina. Okay, that's part of your part of your pelvic exam. And then also looking at the vulva, so looking on the outside. And then also doing what's called a bimanual exam, where we use two hands, one with fingers inside the vagina and one on top of your lower abdomen so we can feel the structures in the pelvis. That's a pelvic exam, but we might not always do a pap smear as part of that exam. And it's always important to kind of separate so we very much understand, did you have a pap smear or did you have a pelvic exam? Because sometimes that gets confused. So what we want to know is who gets screened and when. Everybody with a cervix should get screened for cervical cancer. Everybody with a cervix. And I have to specify that because not everybody may identify as a woman. And even if you don't identify as a woman, but you still have a cervix, you still need to get screened. And then also sometimes people have hysterectomies, but they still have a cervix. And so they still need to get screened for cervical cancer. Screening starts at 21 years old. We don't screen before 21 years old. And I'm going to explain this later, but I'll explain it a little bit now because your risk of getting cervical cancer under 21 is very, very low. For women who are between, or people with the cervix who are between 21 to 29 years old, we do pap smears every 3 years. We do what's called cytology. For cytology, because I keep these things in my desk, for cytology, we insert the speculum. We have a little broom that we use. It looks like this, or a little spatula that's the same size. And we use it to just tickle the cells on the cervix. And then we have a little solution. This is what it looks like. And we dip it in here, we move it around, and the cells kind of get mixed in this fluid. And then we send it off to the lab. We do that, and then the pathologist, so another doctor, takes those cells, looks at them, and looks for abnormalities in the cells on the cervix. And that's basically how it's done. For women who are 21 to 29 years old, they get that done every 3 years. For women who are 30 to 65 years old, we have additional testing options. They can either get just that test that I said every 3 years, or we add HPV testing. That's called co-testing, when you get the cells and HPV testing at the same time. And we can do that every 5 years. Or you can just get HPV testing through the same procedure every 5 years. The preferred method is co-testing. So getting your cytology and getting HPV testing, because that is the best at detecting cervical cancer and the precancerous cells. So the changes in the cells that are going to become precancerous and potentially cancerous. So you'll see those three options there: cytology every 3 years, co-test every 5 years, or HPV testing every 5 years. Now, it's important to note that this is for women and people who have an average risk. Some people are higher risk, like, for example, if you've had a history of cervical cancer or you've had a history of an abnormal result, and then they will get screened more regularly, more frequently. But for people who are at an average risk, who perhaps never had an abnormal pap smear, those are the screening recommendations. Other things. So I said we look for abnormalities and we look for precancerous cells, and we determine what screening what you need based on guidelines. We have specific guidelines that we follow, and we need your history for that. So we're going to look at your age, we're going to look at your past results, and then for treatment, we're going to put your age, your past results, and your current results all together to figure out your risk. And your risk is your risk of developing certain types of precancerous cells and your risk of developing cervical cancer. Okay. So all of this information, and the important thing to note is we do continued surveillance with HPV testing or co-testing every 3 years for 25 years after you've had an abnormal pap smear result that's considered high grade or high risk for ultimately developing to cervical cancer. And I'm going to get into the importance of that a little later, but for now I'll just say the reason for that is if you look here and you see that we say we screen women from 30 to 65 years old. If you've had a history of a certain type of abnormal pap smear, you might need to be screened beyond 65 years old. And that's why I make that point. So, oh, you know what? Let me see. Can I go back here? Okay. So I wanted to show, oh, let's see if you can hear this. So I timed the pap smear. 30 seconds. So that's not that's not too bad. So I wanted to show you that because People often ask how long it takes for a pap smear to be done. It takes about 30 seconds. It's relatively quick. I know one of the comments that someone made on that video was, it feels like 15 minutes. And I know it can feel like that, but it's a quick procedure. And that just gives you an idea of what we see when we're doing your pap smear with a healthcare provider. I wanted to show that. So, third thing to know, and an important point, is that an abnormal pap smear does not mean cancer. There are many different types of abnormalities that you can have when you get a abnormal pap smear result. If you've ever had a pap smear result, you know that it is concerning, right? Whenever we get an abnormal result about anything. So things that are or results that are less concerning. If you have one that says ASCUS or LSIO, ASCUS stands for atypical cells of undetermined significance. It means we looked at your pap smear cells when they were in that little fluid. We took them out, we looked at them, they looked abnormal, but we don't quite know why. Usually and often that's because of HPV, and we're beginning to see the changes. But you perhaps haven't been tested for HPV, or you haven't been tested for, or you have HPV that maybe it's just not showing up yet. And then the other common abnormality that we see is low-grade squamous intraepithelial lesions, which is LSIL. That is often what we see when someone has a um, new HPV infection, and we're starting to see the changes in the cells, but they're not high grade. They're not as concerning. Something important to know, and I didn't mention this before, but going back to that slide about screening, your body usually is going to clear HPV in 1 to 2 years. So about by 18 months. If you get infected with HPV, your body is often going to clear it. And so that's why we don't do pap smears every year anymore. You know, if you, I'm sure, raise a hand if you remember when we used to do pap smears every year. Well, in 2012, we changed the guidelines to be able to space the screening out because we found that people are having abnormal paps, we're coming and they're testing positive for HPV. We're coming and we're testing them regularly, but we're not really improving the outcomes, and they're clearing the infection. So there are all these people that are getting these extra tests done that don't need to have the extra test because their body would have cleared the infection anyway. So that's important to note. So more concerning pap smear results are if you have HSIL, which is a high-grade squamous intraepithelial lesion, or adenocarcinoma in situ, ACIS. So the high-grade lesion is more likely to progress to cervical cancer. They're precancer and more likely to be precancerous cells, more likely to develop into cervical cancer. So going back to that low-grade squamous intraepithelial lesion, that LSIO, if you get a result that says LSIO, and you've ever had that before and it's caused you alarm, the risk of a high-grade cervical precancer is as high as 6.9%. So a risk of a high-grade lesion from that low-grade lesion. But the risk of cervical cancer and actually getting that far is less than 1%. And cervical cancer is a very slow growing cancer. It often takes 3 to 7 years to develop cervical cancer, which is another reason that we can kind of space out the interval. But the high grade lesion is more concerning because the risk that a high-grade lesion develops into to precancerous changes is as high as 53%. So that's a half and half, right? That's significantly higher than the low-grade lesion. And then the risk of cervical cancer is as high as 7% if you have one of those more concerning lesions. So that is why that is important to note. But just so that you know, just because you have an abnormal pap smear result, it doesn't mean that you have cancer. And most of the results that are going to be abnormal are going to be one of the less concerning ones of ASCUS or LSIO. Also important to know, whenever we're talking about prevention, there are things that you can do. There are lifestyle changes you can make to decrease your risk. You can decrease your risk of cervical cancer, and that is true. Um, one thing to know about that and ways to do it are one, get vaccinated. And we're going to talk about HPV vaccination on the next slide. And then another thing is stop smoking. So if you're a smoker, if you know somebody who's a smoker, there's an association between smoking and your ability to clear the HPV virus. If the HPV virus is not cleared by your body, it stays longer and it has more time to infect and cause problems with the cervix that ultimately go on to become precancerous cells or cancerous cells. So stopping smoking is a major thing that you can do to decrease your risk of cervical cancer. Also using protection. Now, because it's skin to skin contact, protection isn't always going to prevent the transmission of HPV. Like you're not going to be able to avoid all skin to skin contact, but it will significantly decrease the likelihood that you'll transmit HPV. And then getting regularly screened, meaning screened on time and screened with the appropriate level of screening. And it's also important to note that most cervical cancers, the ones that we see over over 90% are adenocarcinoma or squamous cell cancer. These are not genetic. So sometimes, and I mention this because sometimes I'll ask patients for their family history, and people will say, oh, my mom's mom had cervical cancer, for example. It is not going to increase your risk of cervical cancer if you have a family member, a close family member who had cervical cancer. So HPV vaccine is the only women's cancer prevention vaccine. It is the only one. There are only two vaccines that decrease your risk of cancer, and the other one is hepatitis B vaccine, decreases your risk of developing liver cancer. But the HPV vaccine decreases your risk of getting HPV and also by developing cervical cancer. So it is recommended for everyone from 9 to 26 years old. So if you have daughters, if you have sons, everyone is recommended to get it from their recommended guideline, I think is 11 to 14. But you can get it as young as 9 and as up to 26 years old. Now, recently, when I say recently, I mean within the last 10 years, HPV vaccine was also approved for some adults between the ages of 27 and 45. And they specify some adults because if you've already been exposed to HPV, like the goal is to give you the vaccine before you've been exposed to any of the HPV subtypes. It is less effective if you've already been exposed to HPV in that 27 to 45 year range, but it is still effective. So it's always good to have a conversation if you fall in that age range, if you've never been vaccinated, to have a conversation with your healthcare provider about if the HPV vaccine makes sense for you. Other things to note. So when I say it is like super effective, it is very effective. It is more than 99% effective when given to women who have never been exposed to HPV, to that particular type of HPV. And there are three types of HPV vaccines. There is only one available in the United States, and that's called Gardasil. Gardasil protects against 9 types of HPV. The two most common low risk types, which are 6 and 11, and that's genital warts. And then it protects against 7 types of high risk HPV that cause most cervical cancers, specifically types 16 and 18, which cause about 70% of cervical cancer. Other things. So the other vaccines are Cervarix, which protects against 16 and 18, which cause cervical cancer. And then there's the one that I mentioned that protects against 9 types is called Gardasil 9. It's the only one that's available in the United States, Gardasil 9. There's also just a Gardasil. That is what we used to give people. So I don't know how old everybody is, but when I got vaccinated for HPV back in my early 20s, they just had the plain old Gardasil. The plain old Gardasil protected only against 4 types of HPV, the 2 low risk, 6 and 11, and then type 16 and 18, which cause most cervical cancer. But again, that's not the one that we have available in the United States now. It's Gardasil 9, which gives you greater protection, is very effective. And it is so effective that, in fact, if most people got vaccinated for HPV, then they would probably be able to space out the screening and have to do less cervical cancer screening. It is also very safe. And because that vaccine has started, is occurred like in the last 25 years or so, there'll be more and more information, but there is a lot of information. So, we talked about the age between 26 and 45. Other things to note about the HPV vaccine, which I didn't mention, is if you, for some reason, got the vaccine that vaccinated against only 4 types, it's not recommended to get the 9 types if you've already been vaccinated. Once you've been vaccinated, you are good to go. It's not recommended during pregnancy, but you can get it while you're nursing or lactating. And we talked about the safety. Yes. Oh, so what I didn't mention is it's not only effective at preventing cervical cancer, but it also reduces the risk of all anogenital cancers. So vulvar, vaginal, cervical, and anal, and also genital warts. And common questions that people ask. So I briefly touched upon this before. Why don't we screen for cervical cancer before 21 years old? And again, that's because the risk of getting cervical cancer is very low. In fact, people who get infected with HPV under 21 years old are most likely going to clear it. So they would end up getting a lot of interventions and a lot of testing that ultimately wouldn't be necessary. Do I need a pap smear if I've had a hysterectomy? It depends. It depends on what your pap smear history has been. So if you've had a history of certain high grade lesions and high grade testing, then there can still be cervical cells in the upper part of the vagina, even if your cervix has been removed. So I'm talking specifically about people who've had a hysterectomy, had their cervix and uterus removed. Um, Even though you no longer have a cervix, you may still have some cervical cells at the top of the vagina. We call it the vaginal cuff. That's the area that's left once your uterus is gone. Because you can still have some cervical cells there, if you've had a high grade lesion or an abnormal pap with a high grade lesion, you would still need cervical cancer screening to a certain point. Can my pap smear results be wrong? It's always possible for them to be wrong. And more commonly, what we see is that they're inadequate. And that is because, and an inadequate PAP means we don't have enough cells. So when we did the little scrape from the cervix, we don't have enough cells. That's also something that happens as we age. So after you go through menopause and your estrogen levels decrease, it also causes a change to the cells on the cervix. Like, yeah, another thing to happen when you go through menopause. And so we may end up having fewer cells to try to test and look for cervical cancer. So you can have an adequate test result. Other things that can cause your pap smear results to be wrong would be if you had another infection, which could cause inflammation and affect the results. If you used a douche, if you had sex before your pap smear, if you were bleeding and on your period. So those are other reasons that we might say, okay, if you're on your period, then let's reschedule your pap smear if you're having some bleeding. What happens if my pap smear is abnormal? So if you remember before when I talked about screening, I mentioned that you will take your results, your current results, we'll take your past results and your age, and we put them all together. It is kind of a complex system where we review all of your results. I use an app on my phone when I'm doing it for my patients because I don't always remember the specific details, but we want to make sure that you are being screened the proper way each and every time. So depending on what that abnormal pap smear result is, you may need to get follow-up, and that follow-up will usually happen at a year or sooner, or you may need additional testing. The additional testing, it's something called a colposcopy. You may have heard of that, the colposcope. It's a colposcope. It's like a big microscope, but it looks at your cervix. So when you're coming in for your exam, you're putting your legs in your stirrups like you're about to get a pap. And then we pull up with this, like I have this little tripod here, but we pull up with this thing and we're looking through it and we look at your cervix. It allows us to look at your cervix very closely. And then we have a solution. It's like a vinegar that we put on your cervix that helps us see the cells that are abnormal. And then If you have abnormal cells, we take biopsies. We then send those biopsies off to the pathologist, the same person who looked at the cells in that little liquid solution, and then they'll look at them and then they'll tell us if they saw anything at all, and if they saw an abnormality, what abnormality that is, and we go from there. So that's a very basic. And if that's something that you're interested in learning more about, then that's what you do in webinar. So now I want to talk a little bit about advocacy. One thing that's very important at Lady Parts Doctor is, I want you to have information, but I also want you to have some things that you can take home with you. What kinds of questions can you ask, and what kinds of questions should you ask when you're with your healthcare provider? Important questions to ask would be, do I need a pap smear, and how often should I get one? Again, that's going to be different for everybody depending on what your past history has been and your age. Number two, am I a candidate for the HPV vaccine? And if so, when should I get it? What lifestyle changes should I make to reduce my risk of cervical cancer? The answer may be none. But if there's a chance that there's something that you can do, it's always good to know and practice a little extra prevention. And then finally, what are the symptoms of cervical cancer that I should be aware of? Often with cervical cancer, there are no symptoms, and we're catching cervical cancer because you're getting your regular routine screening. But other symptoms that you could have would be abnormal bleeding, bleeding outside of a period, or bleeding when you don't have periods. If you've gone through menopause, but you're having bleeding, people may experience lower back pain, pelvic pain, abnormal vaginal discharge. Those are symptoms of cervical cancer, but often people don't have symptoms. What if you want to know more? So on the Lady Parts Doctor podcast, I have an episode, and I will put the link in the chat. An episode all about pap smears and pap smear screening from about 2 years ago. But then also, if you want to know more about cervical cancer, I had a great episode with Dr. Renee Cowan. She is a board certified GYN oncologist, and she practices in Louisiana. She did a great episode with me about a year ago in honor of cervical cancer and cervical health awareness month 1 year ago. And so you can find that on the Lady Parts Doctor podcast. It's available wherever you listen to podcasts. And because also we leave you feeling empowered, this affirmation for you, I always do affirmations at the end of my podcast. And of course, it's not going to be any different on the webinar. I empower myself with knowledge, and I prioritize my health. And I know that's true for you because you're here and you're having this conversation to learn more about cervical cancer and cervical cancer prevention. So thank you for attending this webinar. We should connect. You can email me at info@ladypartsdoctor.com or drhack@ladypartsdoctor.com. On social media, I'm on Instagram at ladypartsdoc. I'm on TikTok at ladypartsdoc. And I am going to stop sharing my screen so I can come and see if there are any questions. Thank you, everybody, for coming and participating. I hope that this was helpful for you. I hope that you got a little more information, if anything, information to share. This webinar is recorded, so if there was something that I said that you missed and that you want to go back and replay, please, please. It's going to be there. I'll upload it after. Were there any questions? Anybody, anything? If you have a question, you can put it in the chat. Okay. Well, thank you very much for attending this first Lady Parts Doctor webinar. There will be another webinar. Oh, I see 2 questions. So odd that it wasn't coming up before. Oh, thank you, Dr. Gonsimboli. Thank you very much for coming. And I see, Doctor, do you still need a pelvic exam if you don't have a PAP every year? That is a wonderful question. That's a wonderful question. So yes, you should still come in and have your annual exam and a pelvic exam, because there are other things that we find during a pelvic exam that are not specifically related to pap smear screening and cervical cancer. For example, having a chance to look at the cervix, look in the vagina, make sure that look at the vulva also. So looking on the outside to make sure we don't see any abnormalities, but then also we can do any testing. I recommend routine screening for sexually transmitted infections, and we do that via a pelvic exam routinely every year, and you may need to get tested more often depending on your number of sexual partners and whether or not you use protection. So yes, it's always good to have a pelvic exam when you come in for your annual exam. But a note of consent, if you come in for an annual exam and you do not want a pelvic exam, that is your right to say that you don't want a pelvic exam, but we recommend that you get them every year when you come in for your annual. And then two, and this will be a moment since I'm talking about consent, there is a guide on what to expect during your OBGYN visit on the Lady Parts Doctor website under education. Yes, I believe it's under education. There's guides, there's a tab, and there's a free guide that you can download with more information. But yes, you should still get your pap smear, get your pelvic exam. Although I think there's another question. Why are pap smears painful? Is there a way to make them less so? So your pap smear should not be painful. Sometimes if people find pap smears to be uncomfortable, there are things that we can do, like making sure that we use enough lubrication. In my office, I stopped using a lot of lubrication because we had a string of paps that were coming back inaccurate because we use too much lubrication. So we also use water. So it's not just lube, but also water. So making sure that there's enough of whatever they're using to make the insertion of the speculum more comfortable. Also, a lot of it is the technique. If you find that you generally have pelvic pain and you find exams uncomfortable, this is definitely something you should discuss with your healthcare provider. And then also there are a number of specialists for people who have pelvic pain. But there's a second part of your question. Is there a way to make them less so? Yes, so technique is a big part of it, and also being more comfortable. So sometimes what happens is you may have had an uncomfortable experience, or maybe somebody said, oh, your pap smear, oh gosh, that hurts. That's super uncomfortable. And so then when you go in, you're already tense and you're nervous. And so when someone goes to do a pelvic exam, the vagina has muscles. And so those muscles, just like any other muscles we have, are very tense. So relaxing as much as possible. I'm smiling a little bit because it's not always easy to relax when you're getting a pelvic exam, but relaxing as much as possible. And then the whoever's doing the pap smear, making sure they have appropriate lubrication, that they are also going slow and according to your comfort level is a good first start. If you find that they're still painful, talking with your healthcare provider about any pelvic pain you might experience and going from there is a good start too. And I think that is it. So thank you very much. And I hope you have a wonderful evening. Stay tuned to Lady Parts Doctor. Subscribe if you haven't already to know about the next webinar. All right. Have a wonderful night.